Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and to delve into the challenges and impact each technology has in practice. This is the Medtronic Med-Ed learning experience. The BIS monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. Reliance on BIS system alone for intraoperative anesthetic management is not recommended. Medtronic's medical education programs are offered to provide attendees education on the FDA-cleared indications and use of our products when applicable. The contents and conclusions of the following program are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers received funding from Covidien LP, a Medtronic company, for the speaking engagement. For this segment of the series, a discussion on anesthesia in the brain, we will discuss the value of brain monitoring. To help provide insight into this topic is Dr. T.J. Gant, Professor of Anesthesiology and Distinguished Endowed Chair at Stony Brook University.
In the perioperative period, one of the problem is trying to manage intraoperative hypo and hypertension, because we tend to equate hypertension with perhaps lighter state of anesthetic. And we tend to associate hypotension, the first thing that you do is you turn down the anesthetic. However, that may not be necessarily the case, because not all hypertension is due to inadequate anesthesia, and not all hypotension is related to over sedation or over too much anesthetic. And this is where I see the value of brain monitoring to much better, more precisely help the clinicians what is the right management when you are faced with hyper and hypotension, which we know are associated with bad outcomes. So I put up this scheme just to go through it with you and give you some example. For example, in the presence of hypertension and tachycardia, perhaps show some autonomic responses. The tendency we do in the operating room is to trying to lighten the anesthetic. To increase the anesthetic, because we think that the patient is inadequately anesthetized. Now, that may or may not be true. However, if you have a BIS monitor that can confirm and to try to help you to much more accurately manage that patient, whether in fact you need to increase the level of anesthetic. So how can that be done? Well, if you have a patient who demonstrate inadequate anesthesia with hypertension, tachycardia, if you look at the BIS value, now if the BIS value is high, then the appropriate amount, management strategy would be to increase the anesthetic, the sedative that you give, either is propofol, isoflurane, or sevoflurane. That would be the right management decision. However, if the BIS value is low, that shows that the patient is adequately anesthetized, and therefore, by further increasing the anesthetic is not the right decision. So in those scenarios, perhaps one should be thinking about using an antihypertensive to control the blood pressure. Without the BIS monitoring, it's very difficult, if not impossible, to tell what is the right management strategy. So perhaps 50% of the time you are right, but the other 50% you may not be correct, because the patient is already adequately anesthetized. And likewise, if you look at the converse scenario, where in a state of hypotension, the natural tendency is that we tend to turn down the sedative agent, the anesthetic, whether it's inhalational agent or intravenous agent. However, if the BIS level is high, that may not be the right decision to turn down the anesthetic, because then you increase the risk of intraoperative awareness. So having a BIS monitoring to tell you what the level of BIS is enable you to better make the better management strategy as to what is the right options in the presence of hypotension. And that is where I find that the neuromonitoring is particularly helpful in the presence of hemodynamic instability.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.